interest is alongside policy and practice, and with a Centre for Translational Research in Public Health, and I'm sure a number of you have engaged with us and are indeed associates, so it's nice to see you all here today. Very pleased to be asked to open this for FUSE. We're very pleased to support this and very proud of Jo and Emily for organising it all as two of our key researchers in the FUSE Centre. Stress, probably something we're all experiencing a little bit with all the uncertainty over the weekend with the political and economic fallout from the Brexit vote. But I think what this day is about much more about chronic psychosocial stress and its relationship to health inequalities. Now, in the kind of history of health inequalities research, in the 1970s there began to be research into stress and its effect on things like heart disease. And there was a widespread assumption at that point that it was, barristers, people in the city, middle-class men particularly, were experiencing higher rates of heart attack, and that the stress of their jobs was somehow part of this. And Sir Michael Marmot was involved in the Whitehall studies, and this was set up by the MRC to investigate this issue around cardiovascular disease. And as part of that work, they discovered that actually it wasn't that heart disease rates were actually higher in the highest groups. They were higher in the lowest occupational groups. And also psychosocial stress, things like lack of control at work, social support, being in a position of being subordinate, not having control over your life or your neighbourhoods, were actually more prominent amongst people in lower occupational grades. This was quite a revelation at the time. Late 70s, the view was that health inequalities were largely caused by inequalities in access to the NHS and or behavioural factors. The Black Report focused a lot in 1980 around material factors to the role of poverty, but the Whitehall studies really led a new causal pathway that was intensely investigated in the 1980s, which was looking at this issue of psychosocial stress. This then became prominent in later reviews, including the Marmot review of 2010, looking at health inequalities, where psychosocial stress pathways and those effects and what to do about them were a very prominent part of the recommendations. A lot of the work around psychosocial stress has been based in the workplace, so it's really great that Jo and Emily have got such a variety of speakers here today to talk about psychosocial stress and health inequalities within the communities and in relation to different health outcomes. So on that, as a historical note, I'll hand over to Emily to introduce the rest of the day.
Thanks so much, Clare. It's wonderful to have that broader historic context as well. Just get my slides up.